When you're running targeted advertising, inevitably you're going to have people reaching out to you that are unqualified for treatment. I hate saying that because I think everyone should have opportunity to have the treatment they need to be healthy. But the reality is there are barriers in people's way, whether that's finances, whether that's insurance exclusions, whatever the case. But how do you communicate with those people? You don't want to leave them just saying, hey, we're not allowed to help you. Because you can. The best way that you can communicate your desire to help them while letting them know that they possibly might not be qualified is to automate that process. Your staff is already wearing too many hats. You need to automate the process. So when someone who has, let's say, Medicaid insurance inquires, they get an automated text message sent out by some type of management system that says, hey, thanks so much for reaching out. I want to be respectful of your time. Let you know your Medicaid insurance does not cover this treatment. Would you like me to give you a call to talk about our financing options? I think we might be able to help you. That way, the patient feels like they're still being taken care of, but you also protect your staff's time so they're not following up with unqualified leads.